Director, National Dengue Control Unit, and the consultants, the Secretary General of the Sri Lanka Red Cross Society, and the Health Subcommittee Chairman, Dr. Ananda Ekanayaka, and the other colleagues from the Sri Lanka Red Cross Society and the IFRC, and from the other media representatives. Very warm welcome to all, and very good morning to all. So before initiating today is we are officially begin our journey under the SLRCS Simplified Daily Action Protocol for Dengue Prevention. So as an initial, I would like to give a brief introduction on the projects, what are the objectives and how we are implementing in the ground level of this project. So when it's come to the Simplified Early Action Protocol, it's a proactive approach designed to reduce the impact of pre-liquids with hazards. So that is developed under the finance mechanism of the IFRC Anticipatory Hub, and that will be enabled to us to conduct the evidence-based intervention to mitigate the dengue prevention. So we all know dengue is a very hazard to the health system, and also it's, we are experiencing two major peaks during the this rain situation. So during that period, it is important to engage with the community and strengthening the community interventions to mitigate the dengue situation in the country. So during that project, we are hope to mitigate that event to strengthening the community actions in through this project. So at SLRCS as an organization, we have the volunteer based around the country, and also we have the active volunteers and network from the national level to grassroots level. So we have the experience in closely work with the health system in national level and RDHS level, and especially in 2017 and 23, we are engaging the dengue prevention activities during the outbreak situation. Also, this is a great opportunity to the SLRCS to strengthening our community collaboration and the coordination with national health authorities and also the district level activities. So when it comes to the project activities, our project is aiming to conduct the strengthening the community actions in order to reduce the dengue prevention, and that will be conducted during the 2 years period starting from July 2025 to June 2027. So when considering the targeted districts, here we have considered the 5 districts. We have the considering the historical data. So we selected Jaffna, Kandy, Gampaha, Colombo and Kalpana district for our intervention. So we are working in the high-risk MOH areas and the high-risk PHI levels, and to work to collaborate the dengue prevention with the government authorities. So here we are targeting groups, the more high-risk groups like school children and other people who are in the common areas likewise. So in this project, we have implementing the project during the 2 phases. First one is the readiness phase. In that period, we are focusing to preparation of the activities. So basically, we are focusing the strengthening community awareness and the community empowerment and preparedness for the procurement of some items likewise. And when it comes to the particular level, here we have considered the total number of dengue cases reported in weekly, the 1,500 cases. So when that situation is coming, so we are engaging in the community level intervention. So in that period, we are engaging with the community and the community level activities like cleaning campaigns and volunteer deployment for the health staff and distribution of the particular IEC materials and engaging the school level activities as well. So we think this is the opportunity to us to work together to combat the dengue situation in the country, and we requested kind support from the National Dengue Control Units and the other media support to mitigate that effect. Thank you. Thank you for that informative presentation. At this moment, allow me to introduce the esteemed dignitaries and welcome them to sit at the head table. We have Dr. Kapila Kannanga, the Director of the National Dengue Control Unit, who is leading figure in Sri Lanka's national dengue response efforts, with years of expertise in surveillance, prevention strategies, and public health coordination. His commitment of the safeguarding communities has played a crucial role in national dengue management. And next we have Dr. Mahesh Gunasekara, the Secretary General of the Sri Lanka's Red Cross Society, a signified medical administrator and a humanitarian leader with over 25 years of experience across Asia, Africa, and also in Europe. His expertise spans not just only in the public health sector, but also in disaster response, emergency recovery programs, and strategic health management. Under his visionary leadership, Sri Lanka Red Cross Society has pioneered forward-looking initiatives, including the introduction of the very first simplified early action protocol on dengue, which is designed to empower communities to take actively preventive action based on climate and health data. Ladies and gentlemen, we will now move to the media briefing segment. It's my privilege to first invite Dr. Kapila Kannangara, the Director of the National Dengue Control Unit, to address the media. So please, you may proceed.
Thank you very much for all the people who are gathered here today, all the dignitaries, especially all the dignitaries from the International Red Cross as well as the Sri Lanka Red Cross and the consultants of the National Dengue Control Unit, the media, and others who are here. Well, I think this partnership with the SLRC and the dengue control unit is a significant role in preventing dengue in this very special kind of occasion where we have undergone a huge disaster, and the second disaster that we might face would be a dengue epidemic. So that is going to create havoc with the people who have already undergone severe hardships due to the cyclone that we had a few weeks back. And I think this is a good time to start this program, especially in the 5 districts that we have selected through our coordination. Those are the 3 districts in the Western Province. That's Gampaha, Colombo, and Kalutara. And then we have selected Jaffna district and also Kandy district. So even now, as you know, with the northeast monsoons setting in, northern province, eastern province, and these areas are under threat again for heavy rainfall during the next coming few couple of days. And so this is like the action before it's assuming that there will be an epidemic. This is action which is a preemptive action, proactive action against what we might expect. And this is also one of the peaks. As we know that there are 2 peaks in dengue for a year. And this is the time that the second peak comes up. And also with this disaster and the rains coming in, we can expect a rise in morbidity and mortality in dengue. So this is to prevent that. And as the dengue control unit, we are also engaged in a lot of work to prevent this. But with the Sri Lanka Red Cross joining in. I think it's a huge asset as well as a huge support for this program, and especially in these 5 districts. So I think that's today we are launching this, and the communities in these 5 districts, the school communities, and the general public, and also as you have seen, we'll be working in places where there is a lot of public movement. So it's very important that these places are looked after, and I think we have in our program various activities which will go on in these communities, which will support the government sector also, the MOHs, especially the RDHs and the MOHs, who will also be working on these aspects. So it's a added advantage for them with the SLRC joining in. And also, it's very important that while we are proactively doing cleaning up operations and making them aware, it's very important that we give them a sort of health education for all, especially the school children, as well as the communities about waste disposal. As you know, dengue is a disease which comes through where the breeding is going on in containers, which are being thrown out of kitchens, which are being thrown out of homes. So therefore, it is very important that these children, it should start from the school curriculum and also in the public, that waste disposal, segregation, waste disposal is very important to prevent dengue. So while the curative services are looking after the sick people, already the incidences of dengue, but prevention is very important, that the environment should be clean, because it is actually an environmental disease. So I think this cooperation between SLRC and dengue control unit, as well as our whole network of public health services in the country, which is the medical officers of health, the public health inspectors, and the rest of the community-based organizations which also support. It's a good network to prevent dengue, especially in these times where the country has gone through some hard times. Thank you. ඇත්තටම මේ අවස්ථාවේදී මම හිතන්නේ මේ ශ්‍රී ලංකා රෙඩ් ක්‍රොස් එකත් එක්ක සහ මේ ඩෙන්ගි කන්ට්‍රෝල් යුනිට් එකත් එක්ක සම්බන්ධ වෙලා තමයි මේ වැඩසටහන අපි අද ලොන්ච් කරන්නේ, පටන් ගන්නෙ. ඔබ දන්නවා මේ වන විට රට ඉතාමත්ම දරුණු ව්‍යසනයකට පත් වෙලා තියෙන කාලයක්. ඉතින් ඒ ව්‍යසනයෙන් ගොඩ ඒමට විශාල ප්‍රයත්නයක් දරනවා. ඒ කාලය තුලදී අපි දන්නවා තව ඉදිරි දවස් කීපය තුළ, එහෙම නැත්නම් ඉදිරි සතිය තුළ ඊසානදිග මෝසම්සුලන් දැනටමත් රට තුළට ඇවිල්ලා තියෙන්නේ. ඒක නිසා අපිට වැසි බලාපොරොත්තු වෙන්න පුළුවන්. ඉතින් අපි දන්නවා මේ වැස්සත් එක්ක වැස්ස ඉවර වෙච්ච ගමන් වගේ අපිට එන ඊගා